Hello, and thank you for joining us. I'm Megan Toombs, a compliance consultant here with HCP, and I have Brandon Oops and Loretta Maddox, who are also compliance consultants here with me as well. Before we get started, I want to go over a few housekeeping items. You'll notice the controls on the right of the screen. If you have any questions throughout the presentation, please type them into the question box and send them to us. If we have a chance to answer during the presentation, we will, but otherwise we'll address all of your questions at the end. So today we want to talk about how the events of this year have impacted healthcare organizations from a compliance standpoint. We're going to discuss new news as well as some old announcements that you might have missed. Our goals today are not only to make you aware of some of the changes that have occurred in the regulatory world during the COVID-19 public health emergency, but also to show you how our program can help reduce risk of exposure and keep you current no matter what's happening in this crazy world.
So this is Loretta, and I want to talk about some of our main focuses this year, and that has been keeping our clients updated on all of the potential impacts of COVID-19 to their practice. And so let's go ahead and start with some of the things that you have no doubt encountered over the last several months. So first of all, clearly there has been a dramatic increase in utilization of telehealth in 2020. In fact, from a Medicare standpoint, they have seen an increase of over 40% of telehealth usage by its enrollees. And before COVID-19, Medicare primary care televisits were less than 1%, and now they're at 43.5%, and that was in April. So they're probably even higher now. Now, from a compliance standpoint, the addition of enforcement discretion for good faith provision of telehealth services has provided a tremendous amount of leeway in the applications that can be used in order to provide that service, as long as the application is not public facing. So the OCR will not impose penalties for HIPAA violations when you are using platforms that may not be 100% HIPAA compliant. And the biggest part of an application, other than the security aspect of it not being HIPAA compliant, is if you are not executing a business associate agreement with that vendor. And so now is the time to really start looking for those HIPAA compliant alternatives, because if you are using something that's not HIPAA compliant currently for telehealth, once enforcement discretion is over, you will be out of compliance. And well, technically you're out of compliance right now, but because of enforcement discretion, no penalties will be issued for that. But going forward, once enforcement discretion is over, you really need to make sure you have all your ducks in a row so that you don't have any penalties going forward. Now, another area that we have seen a dramatic increase with is remote workers. And I'm sure many of you on this webinar have seen this in your own organization. And unfortunately, the use of remote workers doesn't fall under enforcement discretion. So this means that you have to ensure the same level of privacy and security for your remote workers and their devices, just like you would in your own office. And this can be a challenge based on the use of personal computers versus the systems that you have in place in your practice. It's also a challenge for those remote workers who are not the only ones at home. And I think we've all experienced some of this. You have situations where mom and dad are both working from home, and now kids are going to virtual school. So clearly this can be an issue from a privacy standpoint. So what we want to really help organizations with is to think about how to handle these risks. And the way to do that is through having adequate policies and procedures, as well as appropriate technology. And we have certainly received a lot of questions from our clients on this topic. And I feel like we have really been able to help them get through this really super fast implementation of remote workers, and then those who have over time added them. And we do have some really good resources to help with that. The next thing I want to talk about is, briefly talk about, is the Provider Relief Fund. Many of you have probably received money from that fund, and that is fantastic because it has helped you through this crisis and maybe having reduced patient visits and just that transition early on. However, if you want to ensure that you don't have to pay any of those funds back, you need to keep very good records of how the money is being spent, because recipients who received payments exceeding $10,000 will be required to report the use of those funds, and the use of the funds has to fall within the terms and conditions of that you agreed to when you received that payment. And we did a podcast on this topic, and I would highly encourage you to listen to that podcast or contact us for more information, because this can be a very complicated thing, and we want to make sure that you understand what expenses you can track and attribute to those funds, as well as how to actually do that reporting. So the final thing that I want to talk about is a patient's right of access. And way back in 2016, which was clearly before COVID, HHS and the Office for Civil Rights issued guidance on providing patients access to their records. And the reason they did this is because there were a number of patient complaints about either not being provided timely access or access at all to their records, or they were being charged excessively for copies of those records. I could literally do an entire webinar on this topic, but for the purpose of time, I just want to point out a couple of things. So number one, you are required as a covered entity to provide patients access to their records. And two, you can only charge a reasonable cost-based fee, which means if you have been using or you're still using any state fee schedule that has probably been around for a long, long time, that's not going to be considered cost-based and reasonable from the OCR standpoint. So it is very important that you are looking at these things within your practice. The OCR clearly is taking complaints very seriously, and we've seen evidence of that in some enforcement actions that have been taken recently. And I want to share a little bit more about that, about those settlements, because I think there is a misconception that the OCR only goes after large organizations, but that's really not the case. So 5 individual practices were fined for not complying with the HIPAA right of access rule. And I want to go over each of these 5 just very briefly, because I want to give you examples of what this means. So Housing Works, which is a nonprofit organization that provides healthcare, they paid a $38,000 settlement because they ignored 2 requests to provide patients access to their records. And these are just, patients are requesting the records and they're just not getting them. And so patients are then complaining, and once they complain to the Office for Civil Rights, that's what prompts that investigation. The next one was all-inclusive medical services, and this is a family medicine clinic. And what they did is, again, they denied a patient access to her medical records, and then once the patient complained and they were investigated, they agreed to pay a $15,000 settlement. And then we have Beth Israel Leahy Behavioral Health. They paid a $70,000 settlement, and Wise Psychiatry paid a $10,000 settlement. And this was for not responding to a personal representative's request for records. And just as a brief reminder, personal representatives of a patient have the same right of access as the patient. And I think sometimes this gets confused. So it's important to understand that we have to know who has the authority to request that access, and then make sure we're responding appropriately. And the final case was King MD, and this is a small provider office. They paid a $3,500 settlement, which I believe is the lowest settlement in history that the OCR has issued, but they paid that for also failing to provide a personal representative access to records. And so a couple of things I want to mention about this. Number one, if you are a mental health practice, this can be scary when it comes to releasing information, especially when it's to a personal representative. But you can see from what I've just talked about, 3 of these practices were behavioral health, and those 3 requests were from personal representatives. So you need to understand what rights the personal representative has and how that applies to the information that you have. The second thing I want to mention about this is for all of you, whether you're mental health or any specialty, the thing that you need to take away from this is you have to understand the rules surrounding patient access. You must understand the policy, you must have policies and procedures for that access, and then you have to train your staff that are responsible for providing this access, because you could have the best policies in the world, but if you haven't trained the person that's responsible for handling medical record requests, that's going to be useless. So you really have to manage all of this, from knowledge of the rules all the way down to training the people that are actually executing these duties. And the good news is we can help you with all of these things.
Well, and it's interesting because just as we were, putting some of these resources together yesterday, I came across another article about a facility in Phoenix, Dignity Health, doing business as St. Joseph's Hospital, who were just recently handed a fine of $160,000 for a similar issue as to what you just described, Loretta.
Right.
There had actually been a request for medical records that was not thoroughly fulfilled. It was a mother requesting information for her son, and she actually made a request on 4 different occasions between January and April of 2018. And while they fulfilled some of those requests, they didn't fulfill all of them, and she ended up filing a complaint, and as a result, that $160,000 fine was handed down.
Right.
So it's very interesting. That's still happening. I mean, even up to, yesterday was when I found that. But we talk a little bit about the covered entities, but business associates are just, they're held to the same responsibility. And I think many of the conversations that we have with healthcare organizations today is usually revolving around education to help practices and billing companies to understand what it is they're going to be required to do, and how exactly they can meet those expectations. So understanding compliance is not something that is a generally taught subject, which is really surprising, if you do understand compliance, given the nature of the penalties of those requirements, and if they're not met, what happens and what's handed down in settlements and fines. So, it seems that there are new examples just about every other week of fines and penalties being handed down to organizations that could have, prevented it very easily with a little bit of due diligence and support from, a program like the one we have developed. So, it's very important to understand that not just the covered entities need to be concerned with compliance, but as well business associates. So there's actually a recent example I wanted to share of non-compliance. It was actually a business associate located in Tennessee that was fined $2.3 million for a breach of over 6 million individuals, PHI and EPHI. It actually happened back in 2014 on April 10th. The organization CHSPSC, they suffered a cyber attack by an advanced group known labeled as APT18. Essentially what had happened was they were using compromised admin credentials, and the hackers remotely accessed their information systems via its virtual private network, or VPN solution. And that's something that in today's environment is an even more increased risk, given the what did you say, 43.5% increase in telehealth commuting, right, working from home over VPNs. This organization failed to detect the intrusion. They were notified by the FBI on April 18th, just a couple days later, that its systems had been compromised. And what had happened was, during the time the hackers had the access to their systems, the EPHI of over 6.1 million individuals was actually exfiltrated. So what happened was OCR, they launched an investigation into the breach. They uncovered systemic non-compliance within, the HIPAA security rules. And then it's one of those things where, it's safe to say that it's not really possible to prevent the cyber attacks by a lot of the sophisticated threats that are out there. When an intrusion is detected and you are aware of it, action does need to be taken quickly. The idea is to limit the harm caused. So despite being notified by the FBI in April that its systems had been compromised, the hackers remained active in the system for almost 4 months, finally being extricated in August 2014. So during that time, this Tennessee-based business associate failed to prevent unauthorized access, and the hackers continued to steal EPHI over that 4-month period. So there's actually a quote from the OCR director, Roger Severino, that I wanted to share. And he says, in light of this circumstance, that the healthcare industry is a known target for hackers and cyber thieves. The failure to implement the security protections required by the HIPAA rules, especially after being notified by the FBI of a potential breach, is what he calls inexcusable. So, as a result, there was a sizable financial penalty that was, we could all agree is appropriate.
Well, and I want to point out, Brandon, because I think you make a couple of really good points on this, is that number one, I don't think you can say you can prevent cyber attacks, but when the OCR does an investigation, they are going to look for compliance. What have you been doing? And the term systemic non-compliance is used quite a bit in these situations because people are not following the security rule like they should. Granted, that may not keep you from having a cyber attack, but it's going to show to the OCR during an investigation that you have done your due diligence. And I think the point that Director Severino is making is that the OCR is no longer going to take an approach or take the excuse of, well, I didn't know. I didn't know I was supposed to do all of these things. The security rule had a compliance date of April 21st, 2005. We are in 2020. So we can no longer say, sorry, we just didn't know. We have to make sure that covered entities and business associates are following the security rule to the max. In that way, if something like this happens, at least the OCR sees that you were doing your due diligence.
Right, and that brings up another point, right? On top of the fine that was handed down, the OCR is going to require that, this organization in Tennessee adopt a robust and extensive correction action plan to address all of those areas of noncompliance that were found. So the OCR is going to be closely monitoring for the following, 2 years based on everything that had taken place. So, and, I'm sure you can attest, Loretta and Megan as well, that a lot of the conversations that we have with practices and organizations and business associates who come to us, a lot of times it's reactive. Right. Sometimes they're facing down the barrel of an audit, or they read an article like something like this, and they recently find out that, we're almost entirely non-compliant outside of just doing a training module. So, that's a conversation I think we have a little bit more often than we need to when a proactive approach can be sufficient.
Oh, and I agree with that. I think we would rather, so I think we would all agree that we would rather help clients on the front end as opposed to on the back end when they are dealing with a situation like this. However, we're there in either case. And when we do have situations like this, and we do actively help the client through that process, and it can be scary. And so, but again, Brandon, to your point, we would much rather be there on the front end to help you avoid it.
That's right.
But we're there either way.
I just want to add to those with another recent case involving an orthopedic practice in Georgia that agreed to pay $1.5 million and adopt a corrective action plan to settle HIPAA violations. So you notice a trend with these. They're all similar, being in violation of HIPAA. In this case, hackers went in and used the vendor's credentials to access their EMR, exfiltrated the database, and then contacted the practice and demanded money in return for the records. The reason we bring this up is this is something for you to think about from a security standpoint as well. From the side of telehealth and being in compliance with HIPAA, that's one area. But as far as a breach, could you handle the repercussions of having a breach to that degree and breaching the patient records? Like Loretta mentioned earlier, it's important to be within those guidelines, but we want to help you avoid any of those potential issues that you would have as far as reputation control and having, taking good care of your patients. That does affect patient care. So in this case, the organization filed a breach report informing OCR that over 200,000 patient records had been affected, and the PHI disclosed included patients' names, date of birth, social security numbers, medical procedures, test results, and health insurance information. OCR conducted an investigation that discovered a history of noncompliance, including failure to conduct a risk analysis, failure to implement risk management and audit controls, failure to update and maintain HIPAA policies and procedures, failure to secure business associate agreements with multiple business associates, and last but not least, failure to provide HIPAA training to workforce members. We see so many cases like this, and I outlined those on purpose that way because this is so avoidable. We have a program in place that we're helping clients every day to be on top of HIPAA requirements when it comes to training, compliance requirements, avoiding these types of mistakes, training your staffing, letting them know what their requirements are, how to avoid potential breaches. And so it's disheartening to see some of these stories and cases that we've read to you just because it's something that it's so easy to avoid, something we can do so quickly and easily. So you'll notice that the common theme with these, like I said, is that they didn't conduct a risk analysis. Loretta, can you talk to us about the SRA and your experience with practices in that?
Sure. You're absolutely right, Megan. I mean, this is a common trend in these cases for the OCR to determine that there was a failure either to conduct a security risk analysis or it was inadequate if they had done one. And the SRA process it has been historically the highest point of any audit failure, and also something that is pointed to in almost every investigation. So it might be a situation where an organization is being investigated maybe for patient right of access, which has really maybe nothing to do with an SRA. But when the OCR does an investigation, and I want everyone on this call to understand, when they do an investigation, they can look at anything and they can go back 6 years. So when they do that, and that's why Megan listed all of the different things that was discovered, that the OCR discovered during that investigation, is because they get to look at your entire compliance from a HIPAA standpoint. And these things are so avoidable because we offer these tools available to help you get through this process. So from an SRA standpoint, I do want to talk about a few common misconceptions, and that is that it is completed by your EHR. Granted, there may be some EHRs out there that are conducting or helping conduct an SRA on the information in that EHR, but an accurate and thorough security risk analysis includes all of your electronic protected health information, not just what's in that EHR. Now, granted, if you are participating in MIPS or another alternative payment model, then you have to attest to doing an SRA for that EHR. But there's that misconception that that means you're good from a HIPAA standpoint. You might be good from an audit standpoint on the MIPS program, but not from the level of the security rule, because that may not encompass all of your electronic protected health information. It's also not a simple checklist. You cannot just check a few boxes and feel like feel secure about that SRA, because it is not. It is a very detailed process. You have to start with your inventory of all electronic protected health information, and then you have to assess any threats and vulnerabilities to that data. And when I talk about an inventory, I do want to help you guys understand, like I said, it's more than the EHR. Think about your email. If you're using email for protected health information, that has to be included in the EHR. If you are using a telephone system that is maybe voice over IP and patient voicemails are being stored, then that is something that has to be included in that SRA. If you are storing documents in any type of cloud storage, that has to be included. So you really have to look at everywhere that electronic protected health information is. In addition, you really have to look at all of these new things that you're doing now too. You might be doing telehealth. You might have remote workers. Anytime you have a change to something you're doing in your practice that involves electronic protected health information, that means you have to assess that risk. So you have to do a security risk assessment of those risks associated with that. And then from that information, then you can go the next step to try to manage those risks, like making sure you have appropriate business associate agreements in place, making sure you have the appropriate level of security on these devices, making sure that only those who need access should have access. And all of this is a part of that SRA process. Now, I know I've said a lot of things that may have immediately made you guys a little bit nervous, and I don't like to be the bearer of bad news on that, but I do want you to be protected. So if you are thinking right now, okay, we need to look at our SRA, good, because you do. You need to look at it and make sure that you are covering all these bases. And the good news is we can help with that. We have tools available to help you assess that risk and get you to a point of compliance. And so we definitely want you to know that we can offer that assistance.
And I think, at the end of the day, talking about the program, talking about some of the requirements, when we're looking at helping clients, we're looking to help those who need help with, things like the SRA. That's really the idea behind how we've developed the program that we provide, is that the support and that assistance, right? We want to keep that at the forefront, because I think, in all of our experience, we do understand firsthand that compliance can be overwhelming, right? Just from the sheer amount of things that need to be done outside of just the trainings, understanding that you need to do more than just training, right? Being able to find out what those things are. And, just taking a look at some of the data, 74% of healthcare organizations will admit that they don't know the full scope of the requirements that they're expected to meet. And 87% of those organizations will admit that, yeah, maybe we're not meeting some of the requirements that we do know about. I just don't have the time. I'm busy with my day to day. It's not a priority to my providers. They don't think that this is something we need to have, happen. We hear that all the time. So, we can boil this down to more of a unified approach. I think, we've developed this to be all-encompassing, essentially, to tackle compliance for your organization. It's a turnkey platform, really. It's going to provide a simple implementation, and will tackle more than just the required training modules and the policies that you need, but as well the extracurricular requirements that we're talking about, like the SRA. So in many cases, we can tackle onboarding in just a few weeks, right? We don't want this to be a big burden. But when it comes to compliance, for healthcare, there are a few major programs that we try to focus on, HIPAA being the biggest one, I would say, OSHA, corporate compliance, even some human resources compliance regulations, things like tracking business associate agreements, handling breach mitigation, your monthly OIG exclusion checks, even down to your virtual SDS binders, being able to build those out. So we will also be able to ensure and provide support for any required assessments like, the SRA that Loretta was just mentioning, as well as maybe virtual HIPAA and OSHA inspections. So, while we've developed the full suite of compliance tools, what has really driven the success is that, we've set ourselves apart from compliance programs with the live support and the monitoring that comes with this. So the dedicated compliance advisors to each of our clients provide compliance and technical support, as well as, monitoring and tracking your program through each compliance cycle to ensure that those goals and milestones that we've set for you for your tailored program are hit. And I think, out of everything, the biggest elephant in the room right now is HIPAA. I think, given everything we've discussed and some of the bigger things we've found this year, and Laura will talk a little bit about that.
Well, which is fantastic because I love HIPAA. I know that sounds super crazy, but I get really excited. So Brandon and Megan both had to tell me I could not take up an hour talking about this. So I am going to keep it as brief as I can. But I think I've explained the SRA process to you and how we can help with that. But I want to expand a little bit more on our entire HIPAA program because like I said, I do get excited about this stuff. So starting with policies and procedures, we can, when you come on board, we have developed what you need that address the required standards in all the rules, HIPAA security, HIPAA privacy, and breach notification. And so we have those policies in place, but all of those can be customized to fit your practice. And so that is something that's important. Some of you over time, maybe you've bought a HIPAA manual and hopefully it's not still sitting on a shelf with the plastic still on it and a little bit of dust. I have seen that, so I'm not just making that up. And I don't know if anybody on the call has that, but those are things we want to avoid because policies and procedures are only as good as they are for your practice if you implement them and if you train on them. And so we can help you with both, because not only do we have the policies and procedures, but we also provide a very easy way to train with the online training modules. And this is very helpful because I know some of you probably may shut down your practice for half a day or a day to have a in-service on all the different things that you have to do, HIPAA, OSHA, sexual harassment, all of the different things that you're required to do. And because we have the online modules, that can help employees do that at their own pace when it works for them, and we're not losing a day's worth of revenue. You also have the ability to have access, as Brandon was mentioning, to our experts. And this is so important because HIPAA can be scary. All of compliance can be scary. But those of us who work at HCP in the compliance department, we geek out over this. So you can trust that we can help you through the scariness. But one of the key things that I love about our program is that we help our clients with breach mitigation or incident mitigation. So if you have an incident that you don't know, does this meet the criteria of breach notification? Am I going to have to send a letter to the patient? Will I have to notify the media and the OCR? We're here to help you with that. What you would do is you would complete the form that is on our platform, and then it's going to go to a compliance expert that can then walk you through that process. And I think as we do that, those of us who work in the compliance department, that is so helpful to our clients because it is scary, like I said. And so we want to assure you that those are things that you don't have to do alone. And then from a tracking standpoint, business associates. So we've got to make sure, number one, that all of the vendors that you have that are business associates have business associate agreements, because if you don't, you're immediately out of compliance. But we want to help you track those as well. And so we do have the ability to store those on the HCP platform, and you have access to those. And a point I want to make about this, I don't know if anyone has experienced an OCR audit or an investigation, but in the audits that happened a few years ago, one of the questions that the OCR had for covered entities was, send us a list of all of your business associates with all of their contact information. Well, I know with many of the practices I've worked with in the past, their business associates might be in a file folder, in a cabinet, they might be, scattered in different places, they might be stored on the administrator's computer, but they were required, those that were audited were required to get that information back to the OCR within 10 days, and not just the list of business associates, but every other question that was related to that audit. That can be a timely process, and we wanted to solve that for our clients. So once you upload all of your documents, once you enter all of your business associate contact information, that's something that can be easily accessed at any point in time. And finally, I want to talk a little bit about contingency planning. Contingency planning is a requirement of the security rule, and one of the implementation specifications under contingency planning is having a disaster recovery plan. If you don't have a disaster recovery plan in place, I mean, you may know in your mind what needs to happen in the event of a disaster, but if you don't have that in writing, you're out of compliance if it's not a formal plan. And we have the tools available to help you make whatever is in someone's head or in a few people's heads about a disaster recovery plan. We have the tools to help you make that a formal process. And so from a HIPAA standpoint, we really cover all of the bases. And so we want you to rest assured that this is absolutely something that can help you sleep better at night.
And yeah, and alongside of HIPAA, we'll also tackle OSHA. I think OSHA is a little bit more cut and dry when it comes to some of the requirements that you're responsible to meet. Things like, are you keeping your employees safe and being proactive in that process? So, I think a lot of the conversations that I have, a lot of organizations, whether it be, a covered entity or a business associate, very few people understand who is actually excluded from OSHA requirements. And, across all 50 states, almost all private entities are going to be required, both employers and employees. So we want to include this as part of the program. We're going to provide support for policies and procedures for OSHA, as well as the required trainings that we'll need to implement, things like bloodborne pathogens exposure, general safety, hazardous material. A big part of that is customizing an SDS binder. We've made ours virtually available. It's searchable. It's much easier than having to, keep and manage a 3-ring binder with, 500 sheets of paper. We want to make that a little bit easier. So we've included that. We'll also to help with performing a hazard risk assessment. And then, there's even some little requirements like OSHA stipulates that you need to have a compliance expert available to your employees while they're doing their trainings in the event that they need clarification or if they have questions. And so, we even meet those types of requirements in our platform where your employees can turn to us. We can be that expert for them, whether it's OSHA or any other part of the program, so that you don't have to be that expert and you don't have to worry about bringing in a vendor, to be that quote unquote expert just to hit that type of a requirement. So we'll even be providing support for your employees as they're going through training in case they do need some assistance or research or further clarifications.
Another subject that we want to talk about today, we focused a lot of our information and things thus far on HIPAA and OSHA. And as you can see, our compliance program is there to encompass all of the areas of compliance. And one of the things we're seeing, especially this year, is in corporate compliance. And we want to talk to you about how we can create an effective plan to show what steps you're taking to avoid fraud, waste, and abuse in your practice as well. So as we all know, any time of crisis brings out the bad actors, especially in the public health emergency that we've experienced this year. As a result, the Office of Inspector General has increased audit efforts in 2020 to help combat the fraud, waste, and abuse. So the latest in technology is being used by these auditors to look for inconsistencies and uncommon patterns in billing codes and for those that are being used by providers. The unfortunate truth is that most honest providers are the ones being affected by these audits. The result is a lot of time and energy being spent pleading their case and trying to avoid paying Medicare back up to 3 times the amount of the claim, in addition to the other fines and penalties they face as a result. Fortunately, Healthcare Compliance Pros has a very effective solution for providers to show what they're doing to avoid fraud, waste, and abuse in their practice and stay ahead of the audits with our Compliance Risk Analyzer, and we'll go into that. Our corporate compliance program was developed with the OIG's 7 elements of an effective compliance program in mind. So we start by creating and customizing the policies and procedures and training for employees on fraud, waste, and abuse, how to report it if they have any issues. It goes over the whistleblower statute and different things that they can do to try to prevent that in the organization. We do provide a compliance hotline so that if employees do have issues, if they do have questions, they have the ability to anonymously report that to you. You can deal with that situation in-house. You can show documentation of your due diligence in doing an investigation, show the documentation of the findings. We do exclusion list monitoring for all employees, providers, business associates, and vendors. Loretta talked to us a little bit about the business associate agreements that you have in place. We ensure that in the next step to make sure that they are not showing up on any of those, the list of excluded individuals and entities. We work with you to develop a compliance committee and provide tools to help make meetings a breeze. So part of that requirement is not often met because it's something that takes time, it takes energy trying to figure out what you need to go over. So we've made that an easy process with a checklist type system where you can create the meeting agenda in minutes and do it quickly and easily. With these, what you'll notice is with these things in place, it's a lot less painful to respond to an audit and to show exactly what's being done to avoid fraud, waste, and abuse. If somebody comes in and wants to see your compliance plan, they want to see what you're doing in your practice to help avoid this, you can show them quickly and easily the training, the policies, all of the different things that you're doing to avoid that. And as I mentioned earlier, one thing I wanted to talk about is our Compliance Risk Analyzer. So this program is used to analyze critical areas for providers. So it's based on the same algorithms that payers and auditors use. So by looking at a year's worth of claims data, the CRA reports help to identify and address vulnerabilities and determine the likelihood of an external audit. So once we run it through that process, an audit action plan will be developed so the provider can justify codes being used or make corrective action if necessary to avoid any issues that were discovered during that audit.
And alongside our corporate compliance program, we've included a lot of the human resources focused tools. I think a lot of healthcare organizations don't realize that they're there's an increased risk during the onboarding process for new employees, which is why it's extremely important to have a well-developed onboarding program in place. So having things like customized and documented policies, compliance, and organizational trainings, employee documentation and information, including a place for complaints and concerns. Those things can be a lifesaver for anyone potentially facing a disgruntled employee case. So we can help to establish that part of the program as well. We will develop compliance support for any questions regarding policies, documentation, and enforcement. And with HCP's Credential Manager, virtual binders and automatic reminders, you'll never really have to remember due dates. We like to think of it as more of a set it and forget it type program where we can implement the architecture that's going to make sense for your organization and then just let it move and do its thing moving forward with a lot of automated processes. And within that human resources portion of our program, we've developed a deep LMS with a library. We have over 130 modules at this point, and we're continually writing new ones, so that library is growing. We have a lot of some state-specific modules, things like Florida biomedical waste, New York OMIG, Texas HIPAA specifics, and even WSHA. We have a lot of other popular modules, or I guess I should say more in-demand modules, things like preventing sexual harassment in the workplace, active shooter, cybersecurity awareness, opioid crisis training, even down to things like customer service skills. We have a couple of series that we've put together. We have a mental health series, infection control series, which, I think in light of COVID, that one's become a little bit more in demand, as well as COVID modules specifically. I think we have 6 modules on education for administrative and rank and file employees, diversity and ethics, clinical series. We even have coding, ICD-10, as well as breaking HIPAA, OSHA, and corporate compliance into micro courses and talking about some of those subjects a little bit more in depth. So, and the nice thing is that for providers, for any of the practice admins out there, we have CME courses for your providers, so they can kind of do a 2 birds with 1 stone while they take their compliance trainings. Those will also count for continuing education credits. And if there's anything in the library that you guys may need, maybe something a little bit more organizational specific or process specific, we have blank modules, so we can create maybe how-tos on proprietary software, maybe something for billing or accounting, or even just best practices for answering the phone for front desk associates. So even things like that, we have blank modules, and you guys are able to access those and do full customization. And I think it's important to remember because at the end of the day, training is a really effective way to not just increase and sharpen the skills of your employees, but also to boost morale and really improve the workplace overall, because it shows, from an organizational perspective, it's showing commitment to employees, and it really indicates that they're an investment, right? That you care about their future and that you want to see them develop, and that can really boost morale for your employees. So that's one of the reasons we've developed this with such a broad scope.
One of the things we've seen as we've, worked with clients over the years is that some of the reasons that compliance hits the back burner is because of the time commitment from employees that have too many other hats to wear. So one thing I want to emphasize and just talk to you about is our support. This is really what sets us apart. This is something where we take that compliance burden and we really help bear it for you. We have a compliance team that's assigned to your account, some dedicated advisors. So they work with you through the customizing and implementation of your account. They help you automate the program by scheduling ongoing tasks, training reminders, other compliance requirements you may have. They do live virtual training. Unlimited support is included with this. So they can do screen shares. They can show you how to access the program, how to schedule training. If you have compliance questions, we're backed by a senior compliance team that's there for compliance advice. If you have questions about a particular scenario, something that's happened in your practice, you're not sure how to, how to see how a policy that has been developed applies to you, or, something unique, you can reach out to us anytime and we can provide answers to those types of questions for you. Along with that, we do reviews on your account, and we work with you to help you to create that culture of compliance in your organization. So one thing that we want to talk to you, we're going to get into some pricing and some things that we have available for the program to help you on that. But I just want to let you know that we'll be opening this up for questions. We have a couple that have come into the queue already, and we will get to those. I just wanted to invite you, any questions you have, feel free to put those in the chat, put them in the questions comment section, and we're happy to address those during this webinar as well. But one thing I wanted to go over is the pricing. So we keep our pricing, it's a simple process. So the cost per employee, it's a monthly per user fee, and it's scaled based on the size of your organization. And so you can reach out to us anytime for specifics on that, and we would be happy to create a price quote for you so you know what it would be for your organization. One thing I do want to mention, though, is that we do have incentives. Right now, we're offering 25% off the onboarding and activation fee. We wanted to offer this as an incentive because we know that sometimes 2020 is almost over. Do I have all of my compliance requirements there? Have we done our training? Have we done our SRA? And so we want to help incentivize that and just let you know that it's not too late. We do have resources available. We do have the ability to get your program up and running and implemented within weeks, not months. So we just want to let you know that compliance is still possible for 2020 and ongoing. We're there for you for support, and obviously creating that culture of compliance is a process of staying updated on everything. So from here on out, we say compliance now and beyond. So I just want to pull up this slide. I want to invite you to contact us if you have questions specific to your organization, if you have questions about the program, if you want to schedule a free consultation with one of us, we're more than happy to schedule that with you and go over things. I want to share this link as well. So this is a link to a contact form. You're welcome to go in and fill that out, and we would be happy to reach out to you as soon as possible. So now I want to open it up for questions. I have a couple in here that we're going to direct these first couple to Loretta. So Loretta, Leanne is asking, are you required to provide patient records in paper if they ask for it, or can you direct the patient to sign up for a portal?
So very good question. The guidance from the OCR stated that you have to provide access in the form and format requested by the patient. So you can't, even though you have a portal and that seems like the easier way for patients to have access, you can't force them to use it. So if they make the request in paper, you must provide it to them in paper.
Great. And then the next one, hopefully that answers that. If you need more clarification on that, Leanne, reach out to us. We're more than happy to address that with you. Loretta, mother of a 17-year-old female, asked us for copies of her 17-year-old daughter's record, but the 17-year-old does not want her mom to get those. Do we have to get a written authorization from the 17-year-old in order to not give the mom the records? The 17-year-old does not want the records to be viewed by anyone as it has her reproductive health information.
Got it. Okay. Great question. Super hard question, but let's talk about this. So again, this could be an entire webinar. When a minor can consent for certain services on their own, which reproductive health in most states is a service that the minor can consent to on their own, they can control that portion of their medical record. So as painful as this is going to be, you're going to have to tell mom, I'm sorry, but you're going to have to talk to your daughter. And that is not going to go well. So just be prepared for that, which I'm sure you already are. But when that minor does exercise that right of saying, I want to keep my information private, then yes, you do keep that information private.
Right. So, and then the next question was, will there be access to these slides and resources? The answer to that is yes. We can provide a PDF of the slideshow that we used during this presentation. We also have a product sheet that outlines the services that we provide to clients, and we're more than willing to provide any other information or resources about our program that we can offer. If you look in the webinar, I believe it's on the side information panel, there are some handouts that I've already put in there, a product sheet and information on our security risk analysis. So you're welcome to access those. The next question is, how do we contact you? We're a very small practice. Brandon, do you want to talk to them about small practices and some of the tools and support and resources that we have available for small practices, and then just let them know how we can reach out to them?
Yeah, I mean, the nice thing about the program, the way we've developed it, is very scalable. Where we don't really necessarily have a specific area where I feel like we would do best. We handle a lot of clients that are 2, 3 individuals, small practices, up to universities with multiple thousands. So when it comes to providing the support, the nice thing is it's very tailored to your organization. So even if you are a smaller organization, we have the tools and resources that are in place so that you don't have an additional burden with the program, but we would implement everything customized for your specifics, the scope of your practice, and being able to customize things like policies and procedures, tracking documentation, things of that nature to hopefully alleviate the burden of compliance and step into more of a, I think it's safe to say it's more of a virtual compliance advisor role, right, where we can step in and provide that support, and you can basically hand that hat off to us. So if you want to reach out to us, obviously the number that Megan has here on the screen, the 1-855-427-0427, that's a great way to reach out to us. Or you can submit an email if you would like us to follow up through that submission form in that link below. Yeah, just feel free to reach out to us. We'll do some follow up after we wrap things up, and we can open up further discussion if you have more questions.
Great. And the last question is, can HCP do a one-time compliance risk analysis on our physician practice? And so David, I'm going to address that question. The answer to that is yes. We can run the compliance risk analyzer for each of your individual physicians, and we can run 12 months of data. I encourage you, I can reach out to you, or you can reach out to me, and we can get more specifics on how we work the pricing and how we scale that based on how many providers we would be running the data for. But the answer to that is absolutely yes. So we appreciate the questions. We appreciate the time that you've spent with us today. We hope this webinar has been informational. We hope that you have gained an understanding of the changes and updates in regulatory compliance for 2020, some of the recent findings and things that are going on that could possibly affect you, how our compliance program can be something that will help you to become and remain compliant here and ongoing, and that our support is what sets us apart. Those were what we hope were the takeaways for you today. Brandon, Loretta, do you guys have anything to add before we close the webinar today?
Go ahead,
I think I'm
Brandon.
okay. I was just going to say, I think a lot of the conversations that I've had recently are really focused around, okay, well, we're wrapping up, we're in Q4 of this year. Maybe I should just wait until January, right? Just because of the burden of trying to get this going. And, we've tried to make this platform, like I mentioned, turnkey, right? We can get implementation done. We can tackle those things because you can't ever really anticipate when you may face a disgruntled employee or a disgruntled patient. Right, it could be next week, and you could find yourself facing down the barrel of an audit. So the sooner the better when it comes to compliance. It's something I think we see a lot of practices put on the back burner, and then we see stories like the ones we shared today, and even more where they never figured it was going to be them, right? Because there may be a small practice, and the government's never really going to come and audit us, but at the end of the day, there's more risk than just a government inquiry. It can really come from any area. So, at the end of the day, don't put it on the back burner. We'd love to help. That's exactly what we're here for. That's what we do. So just let us know, and we'll be happy to give you some direction and get something going.
I think the final thing I would like to add is that we understand compliance is scary, and it is a lot. As we've talked about, we understand that it's not that those of you who are on the call aren't capable of handling it. It's just a time issue. And so with time and with it being a little bit scary, we want you to understand that we are here to help. And I think that's one big takeaway that I want you to have, is to know that we do have experts here, and that's our job. Our job is to take care of you. So I guess that's all I have to add.
Great. And just so you know, so a survey will come to you after the webinar. We encourage you to fill that out. We appreciate and look forward to any feedback that you can provide for us. We also will have a copy of the recording available, so you're welcome to go back to any parts of the presentation that were helpful. So thank you again for your time, and we look forward to hearing from you if you have additional questions for us.